Chairman, thank you for the introduction. And I arrived here some weeks ago, and I want to thank my colleagues from orthopedic surgery to give me the opportunity to present today on your Congress. It gives me a good feeling to be part of the team. And I want to go back to you to 2009. I think some of them were here. That was the opening of the ATP tournament. But what happened over here in 2005? Which two players were over there? I'll come back to that later. From the literature, we know that from every presentation after 1 year, we only remember 5%. So I make it easy. We start with the 5% and we end with these 5%. That means with epicondylitis lateralis, after 1 year, 90% will recover. This can be a little bit disappointing. No single treatment is superior. And read over here, I think there's almost, we can discuss it, there's no evidence for the use of platelet-rich plasma or shockwave therapy. It was first described in the German literature in the end of the 19th century. They called it Schreiberskrampf or writer cramp, and it was diagnosed mostly in never-ending, always working monks. And some years later, it was first described in tennis players, and they called it the tennis long arm. And we had to wait some year later that it was called tennis elbow. But see, only 5–10% there's a relation with tennis. And although this picture can give the impression that it is an old housewife injury, it also, we see it a lot in males. And mostly it starts after 35 years. And I think there's some similarities with the other tendinopathy. I think 10 years ago we all called it itis, but now we know from biopsy that there's no inflammation, but that's more a degenerative process. So our therapy has to focus on regeneration of the degenerative process. And nowadays I think we call it degeneration and tendinopathy. Although 90% recover within 1 year, we see these patients, they don't recover and they want to return to sport as quick as possible. What can we give them? We've got 40 different treatments for just one simple single injury. And as said before, no single intervention is most efficient. And now I'm going to discuss the most therapies we use nowadays in the practice, and I'll discuss with you if there's any evidence. First, and that's the easy one, just wait and see what's going to happen. And that's an easy way, and even after 1 year, so just wait and see what's going to happen. This line, wait and see, is superior to corticosteroids injections. That's an eye-opener. And it's almost effective as physical therapy. However, physical therapies, as was done 5–10 years ago without many exercises. Orthotics. I think there was a good review in the Cochrane, and there were a lot of patients involved, and they found some evidence for the use of orthotics. So we can consider it in our treatment. Non-steroids, because it's mostly a long-standing problem, we don't subscribe oral medication because of the side effects, so it's not recommended by the Cochrane. However, and I didn't know it, when you put it in a gel or a cream, there's strong evidence that it works. Short term, but there's strong evidence. And especially since the introduction of Alfredson eccentric training, we also transferred it to the elbow. And there are some randomized controlled trials which shows that it's effective in this injury. Some are a little bit conflicting, but overall there is some evidence for the use of eccentric training in this injury. This is very popular in the Netherlands and also very popular in Germany, and I don't know if it's popular in the States. There is some good evidence that it can work for Achilles tendinopathy and medial tibial stress syndrome, some evidence. However, forget it for epicondylitis. There's absolutely no evidence that it works. So that's easy, we don't have to do it. Then we go back to 2005. This is difficult to see. It's Agassi without hair. Autologous blood. The theory behind it is that blood contains platelets, and the platelets, when they come in contact with collagen or calcium, then there's an outflow, a release of growth factors. And these growth factors, they are supposed to be a good part of the healing process in this tendinopathy. And we did systematic research 2 years ago, or 1 year ago, it was published. It's a large article, but you only have to remember concerning autologous growth factor injections. So without concentrating it, only this sentence, it does not work. Also not for the epicondylitis lateralis. But the theory behind it is novel, because when you inject platelets and it can induce a reaction of repair by the growth factors, it probably can work. So the next step was to concentrate the platelets. Platelet-rich plasma. And I think when you were from the States, 2009, there was a large article in the New York Times that it's a promising treatment. And we are now in 2011, and there are 2 randomized controlled trials. One over here, I will come to that later. And recently, I think it was in the beginning of 2011, published in the American Journal of Sports Medicine. 28 patients, and they found no difference between PRP and autologous blood. And autologous blood doesn't work, so it's a nice placebo. However, probably too early to draw conclusions. Only 28 patients were included, so it can be a little bit underpowered. But not with this study. Peerboom's and Goossens, I think one of the nicest studies in this field, they included 100 patients. And they gave an injection with PRP or corticosteroids. And this is the PRP. Every single moment in time, significant increase. The pain score is inverted, so when it's going up, it's a good result. And at this point, at 1 year and 2 years, there's a significant difference between these 2 groups. So is it the effect of platelet-rich plasma or the negative effect of corticosteroids? Because we're talking about this difference. And we can discuss it, and at the same time, when they published their study, we also did a study. Remember, it was in tendinopathy and Achilles tendon, so it's probably difficult to compare. But when you look at the literature with all the studies concerning platelet-rich plasma, you always see this line. So over time, there's a significant increase of minor symptoms. However, when you compare it with a placebo, just injecting water, we found no difference. So then we can have some discussion. This difference, is that caused by the superior effect of platelet-rich plasma? Then it would be nice to use. Or is this a negative effect of the corticosteroids? And for me, in 2011, the solution was given with a good systematic review in the Lancet. And that was shown that after half year, when you inject corticosteroids, people will be worse than without injecting them. And so this was a colleague from the Netherlands, and we had a lot of discussion about it on telephone with a cup of tea or something else, and by email. And remember, we are just simple Dutch guys still walking on wooden shoes, and then we were called by the New York Times to do an interview. And it's always a little bit black-white how they present your explanation. But to my opinion, there's still no good treatment when you look at PRP. And it also shows nice how you can interpret your research, because my colleague said PRP gives better results, and we also proved that steroids did not change pain and disability. So it's just a matter how you present your results. And however, in this interview in the New York Times, we got one referee. It was Professor Federer. I think he's famous in the world for his orthopedic surgery. And he said, in the end, patients getting worse when they get steroids. So you can all make your own decision if you agree with the steroid theory, that it's getting worse, or that you believe in platelet-rich plasma. However, this was the head of the article. So I think we are just at the start. It's a nice start to do more research, but for general practice, to my opinion, we don't have enough evidence to use this in every patient. In summary, my 5%. There's absolutely no evidence for the use of shockwave therapy, no evidence for autologous blood, no evidence for corticosteroids. We can have a debate if there's evidence for platelet-rich plasma. We have to give it a chance. There is some evidence that eccentric training will help. There is some evidence that orthosis will help, so just a brace. And there's strong evidence that just a cram can help short term. Does anybody know 2005 why this game ended? Sorry? They were looking for both. And I think here in Doha they learned a lot about it because last year there was at the souk. They did the same play, they did it on a magic carpet. But what I learned from this picture is that although they play high in the sky, there's still contact with the audience. So for our physician, when we keep in contact with our athletes, then we have interaction and we can keep on playing. Thank you.